Okay.
All right, welcome back to the Crooked Spine Show. I am here with Dr. Zara. She is the leading esthetician. Is that correct?
No, I'm a leading aesthetic provider.
Aesthetic provider for West Hollywood and future Burbank, coming soon. Correct?
Yes, by the way, while we're speaking, we are preparing for our opening, and the opening date penciled in November 4th.
Perfect. We're
So,
getting close. We're getting close. So I'll go through a quick intro for all my guests here. This is a health podcast. So I want to exactly understand how it's going to help you, my audience, and also Dr. Zara's audience too. So if you want to look and feel good naturally, meet Dr. Zara, owner of Zavant Aesthetics in West Hollywood and future Burbank. She has helped thousands of women and men by first understanding what these people really need and want, then providing safe treatments for skin improvement, hair removal, body contouring, and much more. Let's see what Dr. Zara has to offer us today to understand I can help you. So, Dr. Zara, get started. Before becoming an esthetician provider, what was your medical background experience? Walk us through that, please.
okay. My is a medical background. I
Mm-hmm.
get my education as a graduate as a gynecologist, OBGYN, specialized in infertility from Yerevan State Medical University. I am Armenian from Armenia.
Awesome.
And yeah, I was practicing back in my country
Okay.
and really loving helping women. I really feel it's such a rewarding thing, helping not only women, couples to achieve their dream, having a baby, if they've been struggling in some way. And yeah, that's what I was doing before.
Good, good.
Before
And
I
why did you switch? Why did you switch fields, or what was your reason for that?
two reasons.
Ah, okay.
Okay, the first reason I moved to States. When I moved to the States, I have two options. Either I have to go through the residency again to practice as gynecologist,
Ah, okay.
or yeah, you have to evaluate your degree, or decide to explore something else. And the reason why I decide to explore something else, by the time when we moved to the States, my kids been kids like one was 8 years old, another one 5, and
Okay.
I was needing them much more. That
Got it.
was my priority. Then I needed to reevaluate my diploma. That's because my kids were my priority. And then also, I love a lot everything beauty related, aesthetics related. So I start exploring something that will be close to medicine,
Okay.
but beautiful. And that's how I landed by opening Zavant Aesthetics that formerly, by the way, we rebranded. I rebranded this year.
Okay.
The name before was Cosmetic Rejuvenation Medical Center. For 18 years, we have been Cosmetic Rejuvenation Medical Center. This year, I rebranded it. And probably you will ask me why I rebranded.
Of
Am I?
course. Like you said, let it roll. Let it whatever
Yeah.
you want to talk about. I want to make sure my people get to know you. That's the biggest thing is doctors are they can trust you once you get to know you. So that's the biggest
Got
thing.
it. So thank you. And the biggest reason I was thinking it's a little bit outdated name, Cosmetic Rejuvenation Medical Center. It's too
It's too
long.
long.
People have no attention span more than 3 minutes, 3 seconds nowadays.
Yeah,
Like
more than two syllables, like yeah, we're done. We're out.
I know that's crazy, but that's so true. That's why I hired a branding agency that helped me to rebrand. And for 2 months, we've been thinking on the name because you need to feel the name, that should be with you on the same wavelength. Then you will say, yeah, that's it. And then one day they said, you know what, Zara, whatever we'll do you know word savant? I said, no, I don't. They said, the savant, it's a master of the craft, savant. I said,
Mhm.
oh, okay. And they said, whatever will say S, add Z, and make up the new word, Zavant, Zara,
Right.
master of the craft. I said, I love it. That's so cool. And that's we come up with that name. Do you like it?
Yeah. It's very like, oh, it's almost like pops a little bit too. It's more quality too. More
Okay.
quality. Yeah, that's what I was
Yeah.
thinking too. Well, good,
That
good.
that was the story.
Good. And going down to it too, once you came over, like you had mentioned, okay, to go back to school. I remember going to chiropractic school, and someone who was Russian, he wanted to become a chiropractor. So he had to go start all over again for one too. So going into your field now, how is this different? I guess transitioning from there to now here to where that was almost a new field for you. But why did you choose? Why did you choose to become an esthetician provider?
Aesthetic provider, I
Yes.
choose because I love everything beauty related. I love making a change without being it very invasive.
Mhm.
But that's not true. If I will choose my, you know, specialty now,
Mhm.
probably I will become a plastic surgeon,
Ah,
neck and up. Yeah,
got it,
I
got it,
like
got it.
that too. But also, as I mentioned before, I love working
Good.
with women and helping them to feel good.
You've already from your previous profession too. You almost understand how to communicate well with them to really get to know them and have build that trust relationship with them because it's very personal. Correct?
Absolutely true. Yes.
Nice.
Wow, are you psychic reader?
No, no, but I do. And the thing is, when you're healthcare, correct? You have to be able to connect with people.
Absolutely. And you
And
know what? I think that medicine, it's being a doctor or medical provider, it's a privilege, especially a doctor.
hmm
Why? Because people trusting you the most important thing in their life, their health.
hmm
And it's a privilege to treat people, but you really truly need to love it. If you're not loving it, if you're doing it, maybe it's cool, maybe it's prestige, it's money, then you will fail. You need to love people and you need to always understand and appreciate how important is it and how nice that you have the ability to make a change in someone's life, and how important to always appreciate the trust that people giving you, that's
and when
important.
people see that and you're genuine, they're gonna know. When you're not genuine, you fake it. They're gonna know too.
Absolutely. 1,000%. You cannot fake being nice.
hmm hmm
No, if
It
it's
has to
not
be your
in your nature.
personality.
Absolutely.
Yeah.
Yeah.
And why private practice versus joining a group or a private equity group, something like that? Why private practice for you?
Because I like to make decisions. I
Good.
like to be responsible for my decisions. I own my decisions. I own all my mistakes and success.
Good. 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 It's amazing when people don't realize, and it's hard too. It's not easy, correct?
Absolutely not.
No, no.
Yeah.
It's amazing. People think, "Oh, I'm just going to private practice. I'll do my own thing." Are you sure you know what you're getting into?
Listen, if you absolutely right, because when you're going into the private practice, you need to understand, yeah, you will be everything: janitor, receptionist, um, secretary, injector, psychologist,
hmm
everything. And then only after that, you doing whatever you open the practice to do. And but that's very good, by the way, when entrepreneurs or practice,
Yes,
um, let's we're talking about doctors now, when they're opening their practice, no doctors are trained on how to run the practice.
exactly.
There's no such a thing. And when they stepping into it, it's can sometimes can be confusing, and sometimes will be, oh my God, I know how to treat, but I don't know how to
Yeah, the
write the
billing. Yeah.
bills. Yeah, how
Mhm.
write the checks. I have to write so much. How I have to manage my finances. It takes a minute, but it's. But I never look at the things as a challenge. I always look at the things as an opportunity. I never, you like in so many years, no one can say, oh my God, Zara, sit and just sit depressed, upset. No, it's like a task. You have to fix
Mhm.
it and move on.
It's
That's it.
almost you don't worry about it, you just take care of it. For me, it takes too much
Exactly.
time. It's complaining is kryptonite, right? For me, it's kryptonite. So why complain? You're just wasting energy.
1,000% agree with you.
Yes,
There's
yes.
no reason for us to waste energy. We just need to fix it and move on, forget about it, and make a opportunity out of any small obstacle. Mhm.
And Dr. Zara, you've been in practice for how long now?
In aesthetics or
Yeah,
in
aesthetic.
general? Aesthetics, I opened my doors in 2006,
Awesome. So long enough.
18
Long enough.
years.
Gone through COVID, everything else. How was COVID for you? The COVID years.
Amazing.
Mm-hmm. Mm-hmm. Why?
Amazing. I'll tell you why. First of all, I'm a workaholic.
Okay.
I love working. And when first COVID hit and everyone was in panic, we've been on this panic mode, the
Mm-hmm.
TV putting all this negative on us that
Mm-hmm.
we have to, oh my God, we will die now.
Mm-hmm.
And I stay home. I was confused. I said, what I'm going to do with myself, just wake up and have no agenda to follow. But then something interesting happened. A switch turned on in my head and said, okay, it's not only you, it's everyone. You can
Mm-hmm.
relax.
Mm-hmm.
You do not have to worry. That's the first time in my life as an adult I didn't worry what I have to do. I just wake up, make sure my family is doing well.
Mm-hmm.
Then I get bored, right? Because you cannot be in that mode for long enough without getting bored. And then 2 months later, we decide we're opening the doors. They start slowly lifting the
Restrictions. Yeah.
restrictions. And it was shock. We
Mm.
opened the doors and it showed with everyone in the masks and everything. And we wrote email to our patients. We opened, but please come by appointments. Just wait outside. Guess what? I came to the line of people. People been waiting to get Botox done. Isn't that crazy? And you know why? Because Botox, when you have you done Botox before?
No, no. I may look like it, but no, I have not.
Okay, one day you will come here, but we'll just fix that.
Good. That's fine. I'm good with it.
Yeah, the reason why I'm saying so, Botox, when we're doing Botox, it's improving the wrinkle. Of course, I done Botox. I barely can move my eyebrows. Yeah. But when we're doing Botox and it's working, we feel better. And there is a legit studies that the Botox related to the less chance of depression if it's done in this region, in the glabella. The reason why, because we stop negative neurotransmission from these neurons to the brain from the muscles, yeah? And
Okay.
you're not frowning, you do not get this like a negative feedback. So it's a legit study in the Journal of Psychiatric Medicine. So, and the people they come and they just we have a line because everyone were on Zoom. And
Mm-hmm.
on the Zoom, you seeing yourself completely different. So while I'm looking sometimes on myself, I see lines that I never pay attention before, and then, okay, I have to fix this. And that's what happened.
Yeah.
And yeah, interestingly enough, vanity is over the fear of, just you can just get some virus.
Uh-huh.
And that's how it was in COVID. Yeah. And then after that, we've been working regularly. We didn't close 2 months. We have been on the lockdown.
And going into private practice, and like I said, having a great reputation as you have online too, how important is to have good staff for a clinic like yours?
Oh, staff comes before patients. It's very important
Mm-hmm.
because if your people not happy, there is no way any patient, you can be the phenomenal, amazing, or whatever, have a bunch of titles, bunch of diplomas behind your back. No one cares about it if they don't feel welcomed. And who's the gatekeepers? People who are working at the front, and also people who are in the back helping us to with the medical assistants, our lovely clinical providers. They need to be happy, and then they will transmit their happiness to their patients.
It's
Yeah,
almost they're their first impression of not only you, but what you do also. Some people have never had Botox before, like me, or other procedures done. They've heard good, bad. You're there to help them walk through what they really want, what they really need, and what the goal is for them. Correct?
absolutely. You're absolutely right.
Yeah, your first impression has to almost be the best.
Yes, and then it's all the small things are matters. How you have been greeted, how easily you fill out your forms, how long you wait,
Mhm.
and how attentive the all the personnel in the clinic. Yeah,
In the field of aesthetics, since you've been for 2006, how has the perception from society changed about Botox, body contouring, hair removal? How has that changed the last, say, 15 years?
drastically, drastically, because in the beginning when I was one of the people sometimes calling me OG
Okay.
in this field. I'm from the very beginnings.
Okay.
And in the beginning, when people been referring to us for injectables, for lasers, they saying, let's say, especially for injectables, Botox.
Okay. Okay.
Don't say I'm doing Botox here. I told my friends I'm doing laser hair removal, but I want them to come to you. But now it's a lunch topic. Everyone talking about it. I think if I will tell you, oh, have you done Botox, you might feel a little bit awkward if I will ask you that 10 years ago
No.
or
No.
15 years, right? But nowadays it's normal. Just she's asking, I will tell yes or no, right?
It's like someone getting their hair colored before. It's like, oh, no, no. Now it's like, oh, if I don't color it, then there's a problem.
Exactly. Now I think the same because Botox become so affordable.
Hmm.
Women, if we will do this girls math, we were spending much more time on the manicure pedicure,
Hmm.
and it's norm, everyone should have it, right?
Yeah.
That Botox is less expensive than manicure and pedicure, surprisingly, because manicure and pedicure girls doing every 2 weeks, Botox you're doing every 3 to 4 months.
Wow. Wow. Again, this is stuff outside my realm. That's why I want to ask all the questions. So not only I know people that haven't had done yet or may want help for depression, anxiety, overall looking good is the key, especially if someone's post surgical, whatever it might be, also. Wow.
Absolutely.
Fantastic. This is, and talking to, looking at your site and how your site works, how does the first consultation work with your clients or having someone else do it? What kind of questions do you normally ask or want answered from your new clients?
So we're starting with collecting anamnesis. Basically, we're getting their health history. Then we're evaluating. I like to give very comprehensive consultations, and I
Okay.
train my staff to do the same way because for us important to create a rapport with our patients, and
Huge.
I don't want our patients come for us for once or twice and go to other
Hmm.
clinic because we want them to build a rapport with us and we can be the ones who will be responsible for their beauty journey. But it's very important. And after that, we're creating a detailed treatment plan. And then they will find out how much it will cost. If they want to apply for some sort of um, credit lines with the companies, my staff will help. And then after that, we will start executing it.
It's and how much is it an emotional not knowing what it is? Is that still a problem? Some people come in door, they know right exactly what they want every time.
They know what's the problem in
Okay.
their head, but they know how to fix the problem.
Okay. Got it.
And
Got it.
that's our goal as professionals to explain them and give them navigate them in the right way.
Good. 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 And regarding Botox or other injectables too, and you talked about the need or the benefit of depression and things like that. Is there any safety questions people ask a lot about, or how does that work? And also any home care afterwards they have to do when they get injectables.
Safety, everything is discussed during the consultation. Sometimes I am telling them, if you want to scare you, really, you can die, get blind, this and that. I'm reading what I see on the PI.
But yeah,
You know, yeah,
people believe what they hear or read all the time, which is whatever.
I know. But other than that, jokes aside, we're going in details about all the possible side effects, about pre and post care instructions, and every procedure has tailored pre and post care instructions.
Good.
That always improves because more you work, every day I'm learning myself too. So I'm doing it for a very long time, but I'm still learning. Every single day I'm learning something new. And that's why I'm adjusting all the pre and post care instructions as well.
Is there any red flags that you would want someone not to do or start with injectables?
Red flags, it really depends. If I am just really spending time on learning their his medical history,
Okay. Okay.
and then also if someone has more psychological or psychiatric issues, or if they have a body dysmorphia,
Mm-hmm.
I will talk them out of doing the injections for sure,
Why?
because
I
it's
know
more,
why, but tell the audience why.
I'll tell you why, because it's more. You know what? It's adding the gasoline on the fire.
Mhm.
That's why. Because if that person is so vulnerable, they coming to you and they saying, "I want to do more lips," when their lips can have their own zip code, like the huge, and you will say, "Of course, I will do it. I'm adding gasoline on the fire," because I am just making this person more vulnerable, more insecure, and saying, "You absolutely right, your lips horrible and you look horrible, let me fix it for you." I rather, it's easier for me as a provider to do so. A, less energy I will be spending, but then definitely I won't be able to sleep at night if I'll do something like that. B, it will be money in my pocket that I feel wrong that I took that money in the reality, but it's easier, it's less time. You the patient, I'm even the clients, not patients, they healthy people, yeah, in general. They coming, you book my time is money as well. I
Mhm.
rather you come, just do very transactional relationship. You came, you paid, I did, you left. But I will spend my time talking you out of this, because A, I feel that person was taking advantage
Mhm.
before they came to me. And there is a reason why they end up coming to me, because there should be someone who will be stopping them from doing all this. Or at least I will talk. And sometimes people very adamant. They know I want to do it. And they sometimes becoming a little bit rude. I'm not their psychologist or psychiatrist, but then I will just many times I will say, okay, I'm not going to do it. I'm not charging them consultation fee,
Mhm.
which I technically should,
Yeah.
because
That's what they
that's
signed
my
up for.
time. They
Yeah.
sign up and they know about the consultation fee, but I rather not to charge them. And I'm saying I don't feel we are the right fit as a provider and the patient. So yeah, I'm not going to put my signature on your face.
It's almost like, okay, if I do this, now my standard of care, my own reputation, now I've just dropped down a notch. How much more do I want to go down? Or actually, having staff too do consultations, am I setting the example of what we're going to have a gray area versus should be black and white? This is what we do, because that patient then goes home and goes, I this one didn't do it, this one did do it. Now there's too much gray area, too much confusion, I think.
That's true. You're
You know.
absolutely right. But you have to have we have our moral codex, and we have to go with our moral codex. We need to feel, you know what? Uh, I love what I do. I
Mhm.
really take pride of my work. I love helping people to feel their best. and I love to be rewarded. All of
Of
us
course,
working
you
at the
should
end
be
of
paid.
the
Yeah,
month for money, yeah.
yeah.
But the money should come as a nice reward for what you do and making people feel good, not just come first and then whatever will happen afterwards. It's a wrong, yeah,
It's almost you want to treat them or give them treatment based on the results already. Once they get the treatment, they're going to get this. They're going to feel good. They're going to look good. They're going to have less problems for one too. It's a lot of you can see that coming in the door. Okay, this person is right for my clinic. This person is someone's going to be here and
absolutely.
be
You
a
know,
and stick with it.
yes.
You know. And what are your other services you offer to besides injectables or Botox?
Oh, by the way, that's a good question because
Mhm.
I think I can. You will be the first one who will know. We
Okay.
are with our Burbank office launching new membership program that I really curate throughout the years,
Okay.
and the membership program will be for our patients who are will come, complete the treatments, and then after that, they will be able to come and just keep up the results with the maintenance, with the very reasonable price services, very reasonable.
Good.
The goal for me is to make sure everyone who just did their treatments, because treatments can be pricey, but then after that they have to go into the maintenance regime, and not everyone can continue spending so much money and to keep up the maintenance. That's why I come up with the program that they will be coming and getting access to very high end
Mm.
lasers with my really elite providers, with the, I don't know, fracture of the price. So
It
yeah.
almost makes them go, okay, if you want it, you want to feel good, but you want to stay feeling good and looking good. Is this a commitment you want to make at a price where we're able to help you out to make sure you have a long term, if you want to call it lifestyle versus a one time thing?
Absolutely. It's the same with everything.
Yeah.
Exercising too, with diet. Doesn't matter where. You
Hmm.
have to keep up with your job, with your like in your profession too, right?
Yeah, of course.
You adjust them, but they need to follow whatever directions you will
If
give
I
them.
just adjust them as a chiropractor and go, okay, now go eat a bunch of donuts, don't work out, and I'll see you in a month, they're gonna have the same problem. I want to work less hard versus having to fix the same problem every time. So same thing like you. Let's keep them healthy, keep them looking good the whole time.
Absolutely. You're absolutely right.
And why did you become a trainer also besides just working your own private clinic and treat local people?
Trainer, because I really truly believe that we need to share our knowledge.
Mm-hmm. Mm-hmm.
And when I was starting, and a lot of my colleagues who started with me a long time ago, we've been learning on our own mistakes.
Okay. Okay.
Or we've just been experimenting and just learning that, oh, this way is working better, even though PI on the product telling you do this, but no, if I'll do this way, it will look and work better. Now newcomers, they much like here, and they have so much access, and they have so many people who willing to share their wisdom with them. That's why I decided to accept the position that I was offered by the two major companies, Allergan and Galderma, as their national trainer and speaker, because I true believer, if you know something, there's no reason to keep it to yourself. There's enough wrinkles for everyone, and we need to share our
It's
knowledge.
almost you're not reinventing the wheel by having someone else learn faster by your but mistakes and benefit, right? I always like to have, I call them an old person on my side. I can talk to just about life stuff too, because they just been around a long time. And if you have, like I said, if
Absolutely.
Zavant's been around for a long time, successful opening up a second clinic, they must be doing something right.
So true. I agree.
No, it's something when same thing when I was coming through chiropractic. So I had a mentor afterwards. I bought into a practice. I had him come back and mentor us also. So there's a lot less learning curve that way. You don't have to break anyone's neck to learn the hard way.
But sometimes people still not realizing it.
Hmm. Why
But
is
then
that, you
they
think?
have, you know why? Some people are arrogant. Some people think that, they know better.
Hmm.
until probably they will hit the issues, and then they will be realizing why I did take advantage of
And
training.
sometimes if I tell people if they've seen someone who's a chiropractor before me and they
Hmm.
were hurt or didn't write the information or didn't write things, sometimes it's the person, not the profession.
Oh, always it's a person, not a profession. It's the you know what? There is a signature, and there is
Okay.
a signature of footprint for every single person. So that's why exactly we have our set of skills, we have our vision, we have our taste, and everyone is applying all this in my profession to what they are doing, and it's not about laser, it's about who holds the laser. It's not about the product or syringe, it's about who's holding that syringe.
It's
Because
not the equipment, it's the professional doing the work on you, correct?
absolutely,
And
absolutely.
what would you say is Zavant Aesthetics, their signature?
Zavant aesthetic signature: experience, expertise, always having our patient's best interest in the back of our heads, result driven, and yeah, like a long-term relationships.
And that's why when I looked at your reviews too, it's almost like my friend sent me here, and I was really happy. It's almost like you have now enough people who are happy with what you offer to go. I market, but because I want people to know more about aesthetics, I want more people to know that don't know. If some people come in from referrals already, it's like I'm good just the way I am.
Yeah, like I mean, if I'm in the practice for so long, that's when I'm doing something right. And now, what also different about us, about Zavan, that all the clinical providers, they trained here by me,
Hmm.
and they trained by one amazing colleague of mine, very brilliant doctor as well. And we have very high standards,
Mm,
and they know if they're working, people who are working here, they have the same mottos in their life.
good,
That's very
good, good.
important.
And this is the end of my topics. Anything I may have missed that you want to add to the show notes or add to the show for my audience?
Not really. I really feel your show is spreading the positive energy. Your show is so just opening the doors for the very interesting conversations in between you and your guest. And I'm so thankful that you're having me at your show.
And my show is really not about I need a lot of views and blah blah. It's just the right information. I'm gonna
Absolutely.
like I said, we're all done, but I have all the connections for your how to book on your website, your Instagram, your reviews also too. Dr. Zara, easy talking to you because we have the same mentality of we just want to help people.
I agree with you. I just felt that when we've been talking, I felt
Mhm.
that you have the same, yeah,
You can't fake it.
reason. No, you can't.
No, no.
And there is no reason, and what I'm feeling nowadays, um, and it's happening, I think, after COVID,
Mhm.
people separating, people who are more on the higher vibrations, on the higher energy, they're going one way. People who are stuck in the more materialistic world, they're going other way. And there's no right and wrong, it's just a separation.
And my side question too, how old are your kids now? How old are mine are 22, 22, 26, and 31 as far as I know. That's all I have.
I
How old are your
have
kids?
as far as what you know. Mine is 30 and 27.
Okay, so yeah, you're done with all the high school stuff, so now you can just focus on you taking care of you and keeping it simple.
True.
Easy, easy.
But no, we still, while we have kids, they are our kids. While we're alive,
Yeah,
our kids are still our kids.
we say we don't have to do all the other stuff we had to do when we're taking care of them directly. So thanks
Yeah,
for being on my show. Appreciate it. I'm gonna hold off 1 second. I'm gonna end the show on my end, but we'll continue talking for 1 second. Okay. Thanks for watching, guys. Appreciate it.